Hello everyone, my name is Max Birch, and today I'm going to show you a brief presentation of the functional movement systems, which has been the focal point of my internship this past spring. So without further ado, let's get started. So what is it? So functional movement systems, or the FMS, is a somewhat newer approach to rehab and training. It was formed in 2001 to improve the overall scope of performance, fitness, rehab, and management of injury risk in active individuals. It was also the intent of the founders of FMS to provide a better system for sports medicine, fitness, and strength, for professionals to identify movement dysfunction as well as improve communication between the professions. So in doing so, the FMS assesses a variety of patterns and attempts to improve mobility and stability in their facilities. So I guess the first thing we can do is just to apply it immediately. So let's try it. So this is a video of me showing you just a small sample of what the FMS has done in my life. And yeah, let's dive in. I do apologize for the audio in advance, but here we go.
Alright, so now I'm going to show you the corrective exercise that helped me touch my toes for the first time in about probably 10 years. And we're going to do it all in one take, just so you'll believe me. So first, I'll show you my initial test before the exercise. So here's about as far as I can go. And that is as far as I can go. Nothing like that. So now we'll go ahead and do the ankle circles. So you can find a hand or a rope or a dog leash, something like this, that replicates movement. And we'll put it around my ankle. We're going to do ankle circles. It's really improve my touch. We're going to pull so you feel a complete stretch in the hamstrings and the calf. Make sure you are dorsiflexed as much as possible. And you're going to pull the leash or the band as much as possible. You do ankle circles. I usually like to do 5 or 10 counterclockwise. And then 5 or 10 in the opposite direction. And then whoosh. We'll retest. And all the way to the floor. Do that.
All right. So, how did that work? It was curious, I know. So, what we saw was the pretest before I attempted to touch my toes, and I got almost down to my ankles, around there, and I couldn't go any further. I was kind of tight. And so the ankle circles went after a restriction, the restriction being my ankles. So in the past, growing up, I had always been an athlete and I played soccer and basketball, and I suffered a few ankle sprains in my high school career. And so that became a restriction for my toe touch. It was very tight. There was a lot of neural tension that was preventing me from going any further and further dorsiflexing, which is what the ankle circles were essentially replicating. It almost acted as a nerve glide to loosen the tension of the nerves so that I could get those extra inches in order to touch my toes. And so essentially, that was a positive corrective exercise. And we'll go into some of the corrective exercises later in the presentation. And so, what you didn't see in that video was some of the negative exercises. So, in other words, it had a negative response to the outcome of touching my toes. Certain exercises or stretches that I did would not help with my attempts to touch my toes. So the toe touch is just one of many kind of goals that the FMS attempts to improve. However, the main kind of curriculum of the functional movement screening system has about 7 different functional patterns in its repertoire. So the first 4 here are the deep squat, the inline lunge, the shoulder mobility, and the hurdle step. And then the last 3 are the trunk stability push-up, the active straight leg raise, and the rotary stability. Now, all of these kind of movements are scored on a scale of 1, 2, or 3. 1 being not good enough or not passing, 2 being just good enough in passing, and 3 is basically exceptional. You have kind of maximal range of motion for that exercise. So, for example, the active straight leg raise, a 1 would be if the medial malleolus of the ankle, when you attempt to raise that leg while the other one is flat, when you attempt to raise it, the medial malleolus does not cross the midline at which your iliac crest of your hip and the top of your patella meet. It doesn't cross that line. So you can see him in the picture there holding the ruler for where that area is, and she crosses it, so that would be a 3. If the medial malleolus of the ankle does not cross it, it would be a 1. And if it meets it, it would be a 2. And so for each of these patterns, there is going to be a scoring system. And if you do not meet the expectations, if you get a 1, then we take you through a screening process to improve those. So what does the screening process entail? So there's kind of 3 main prongs, if you will, to progression. So the first one is breathing. So let's say if a person has horrible posture, maybe an anterior head or rounded shoulders and a sunken chest, if that happens to be their posture, they could be restricting a anatomical airway and restricting their breathing, and they have a hard time kind of recruiting the necessary pathways to perform a movement. And so, for example, my supervisor, Jeremy, if the goal is to touch the toes in his pretest, he gets close, maybe a little bit more closer than I did in my pretest. But after doing a breathing exercise called crocodile breathing, where you're laying prone on a flat table or a surface, and your arms are by your side, and you're breathing in through the nose, out through the nose for about a short period of time, usually around 3 to 5 minutes, and then retesting, and he can touch his toes no problem. So that suggests that he has a breathing restriction. Now, if that doesn't work, the next step would be to move to a soft tissue progression. So oftentimes in the facility, we'll use the massage guns on people. We'll have them laid on the table, and we will do a complete kind of rundown from the top of their skull to their feet. Basically, the point of the soft tissue work is going after muscle knots and trigger points. We're trying to improve blood flow, stimulate the lymphatic system. It also decreases your likelihood of soreness after workout. So we'll do those, and hopefully, they can feel more relaxed and possibly get some more range of motion in their screening. The last one is the corrective exercises. So as you saw before, my corrective exercise that was a positive for me was the ankle circles. So these are, if these exercises reveal limitations or asymmetry, you kind of have confirmed a mobility problem within a pattern. And it should be like the primary focus of the exercise session. If there's no change in mobility after doing various exercises, don't proceed to stability work. Use the exercises to prove mobility is present first, or continue working on all mobility problems until you kind of note a measurable change. So it doesn't need to be completely full or normal. It's not going to be magically healed after one corrective exercises, but an improvement should be noted, even if it's minuscule. And then you can proceed to stability corrective exercises only if the increased mobility allows the person to successfully kind of get into the appropriate exercise posture and position. So the purpose of the stability exercises, they're going to demand posture alignment, balance, and kind of control of external forces within a newly available range of motion and without the support of compensatory stiffness. So considering stability exercises as challenges to posture and position rather than, conventional strength exercises is kind of the right approach. So basically, in conclusion, the rehab process in the FMS kind of process is going to be different for every person. It's never going to be a one-size-fits-all rehab plan. We assess various angles of rehab to see what creates the most benefit to that person. And if, nothing works, we're going to try again. It's a lot of trial and error. And once we find a positive movement, we hammer down on it. We really make sure they're improving their mobility and stability before they move on to strength. And of course, if they're without pain. And so that is the gist of the FMS screening process. Thank you for watching.